our title was ECG for the beginners, basic and principle of the ECG. Under this topic today we will be discussing about the report of the ECG. Remember, this is the last lecture about the basics and fundamental of the ECG. Inshallah, if in the coming days or the next week we will start about the advanced ECG, especially from the arrhythmias. Now, this was about the last lecture of the basics and principle of the ECG. This topic is called report of the ECG. I think you are familiar with this term because we have got a lot of interpretation in obstetrics, and bedside discussions. So ECG, when we want to give a report of the ECG, report of the ECG is divided into two parts. One is interpretation of the ECG, and the second is description of the ECG. Or first is description of the ECG, and then interpretation of the ECG. In short, how should I report an ECG? How should I report an ECG? Or how should I read an ECG? Both of them are the same. Right now, you guys, until now you have understood enough, or you have got enough information about the basics and principle of the ECG. If we don't know about the basics and principle of the ECG, we can't interpret the ECG. So basics and fundamental of the ECG is very essential for the interpretation of the ECG. If we don't know about the interpretation of the ECG, we can't interpret the ECG. Remember, interpretation of the ECG involves the pattern of the ECG. Interpretation of the ECG involves recognition of the pattern of the ECG. If we don't know about the pattern of the ECG, we can't interpret the ECG. So this was a very short lecture, and our topic was interpretation of the ECG or description of the ECG. How should I report an ECG? How should I read an ECG? Since I told before, you have got enough information about the basics and principle of the ECG. If you don't know about the basics and principle of the ECG, you can't interpret the ECG, because ECG, interpretation of the ECG, involves recognition of the pattern of the ECG. This is a very short lecture. Right now, the report of the ECG is divided in two parts. One is description of the ECG. Another is interpretation of the ECG. Interpretation of ECG. What does it mean, interpretation of the ECG? After description of the ECG, we should come to this topic, interpretation of the ECG. If we have got a normal ECG, we'll accept this is a normal ECG and it does not need any further explanation. If the interpretation of the ECG involves abnormal pattern, we should focus about the abnormal pattern to find the underlying pathology. So report of the ECG is divided into two parts. One is description of the ECG and another is interpretation of the ECG. Under the topic of the interpretation of the ECG, the first is rate. Under the topic of description, we should think about these findings. First is rate, the second is rhythm, the third one is abscess, the fourth one ST segment. When you are talking about the ST segment, you will immediately think about the 1 millimeter down of the ST segment and 1 millimeter elevation of the ST segment, particularly above the MI. And then 5 RVH and 6 LVH, or 7 RPV and 8 RPV, or totally this is called bundle branch block. Under the description, we should discuss about the rate, rhythm, axis, segment, RVL, LVH, RPV, and LVV. Right now, you are familiar with the term of the rate because we have got a lot of this discussion and bedside discussion about the rate. A rate, normal rate between 60 to 100 beats per minute. Less than 60 is called bradyarrhythmia, more than 60 is called tachyarrhythmia. The second is rhythm. Rhythm. How should I define the rhythm? Or in the ECG, a normal rhythm is the rhythm which have got well-defined P wave. Or it means this part of the atrium should be stimulated by the SA node. If atrium is stimulated by the SA node, they produce over the ECG paper a well-defined P wave, which representation of the normal rhythm. And every wave should be followed by QRS complex. Or every wave should be preceded by QRS complex. The axis. How should we also have got discussion about the axis? If the standard limb lead, especially lead 1, 2, 3 is upright, we call this axis is normal axis. And about the ST segment, if 1 millimeter ST segment is down, we think about the Angina, unstable angina, non-ischemic, and 1 millimeter elevation of the ST segment. You should think about the infarction, transmetal angina, precarditis, and Brugada syndrome. RVH and LVH. RVH and LVH for the RVH and LVH we should height of the if and for LVH, if you have found a large RVH in V1, immediately we should think about the right ventricular hypertrophy. But remember, on condition that we say this patient have got right ventricular hypertrophy, that should exclude posterior wall MI as well as WT syndrome. And LVH, I think you should be familiar with the term of LVH. It's the algebraic sum of the S in V1 and R in E5. If it becomes more than 35,
we accept this LVH.
And the right bundle branch block. We have got a nice discussion about the right bundle branch in a future lecture, and also about the left bundle branch block. And in addition to these things, we also should think about the morphology of the wave, especially P wave, QRS complex, and T wave. In addition to this morphology, we should think about the QR interval. How many interval is very important? 3 intervals. QR interval, QRS interval, and QT interval. In addition, we have got 2 segments, PR segment and ST segment and TP segment. Among of these segments, which segment is very important? ST segment is very important. And finally, T wave and QT and QT interval. So, right now this is a normal ECG pattern. After that we have finished basic and principle of the ECG, we should know about the normal pattern. This is lead 1. Which lead? Standard lead 1. We have got 10 electrodes, but we have got 12 standard ECG leads. We have discussed this matter already. This is a lead 1. For each lead, 3 QRS complexes enough. This is P, this is R, this is Q, this is R, P, R, S. This is a normal pattern of the 12 ECG lead in lead 2. Lead 2 is larger than the all lead of the ECG. The R wave of this lead is a little bit higher. And the lead 3, P, Q, R, S, T, this is represent lead 3. AVR is a negative lead. All lead P, Q, and T, all of them is a negative. And AVL is the smallest lead. This is the AVL. And after that, this is the AVF. This is standard limb lead. This is augmented limb lead. And then you will come to the chest lead. This chest lead, this is the V1 and V2. In V1 and V2, we have got small R wave, which is called septal R. In V3 and V4, R and S, both of them are equal, which is called transitional point. And V4 and V5 represent large R wave, especially V4, which is represent V6 or ventricle. So this was our last lecture about the physics and fundamental of the ECG. Inshallah, we will discuss about the arrhythmia in a few, or after the 10 days after that we take or we get a test from you. Now, again we will discuss this matter. Report of the ECG. How should I know? What is the meaning of the report? Report of the ECG is divided into pattern in 2 categories. One is interpretation of the ECG, another is description of the ECG. Or in a simple, how should I report an ECG or how should I read an ECG? Remember, right now you get enough information about the basics and fundamental of the ECG. If you don't know about the basics and fundamental of the ECG, we can't interpret the ECG properly. We can't interpret the ECG properly because interpretation of the ECG involves recognition of the pattern of the ECG. So this is very essential. Under the topic of description, we should explain the rate, rhythm, axis, ST segment, RVH, LVH, RVV, and LVV. And in addition to these things that we should focus on that, we should also discuss about, or we should pay attention about the waves, especially P wave. There is no QR wave and S wave. The second thing that you should think about the QRS complex total. And the last wave, which is very important, is the T wave. Interval. How many interval is very important? 3 interval. QR interval, QRS interval, and QT interval. How many segments do we have? Got 3 segments. One is QR segment, another is ST segment, and another is TP segment. So among of this segment, which one is very important? ST segment. Why it is important? Because it is represent a critical situation, especially acute myocardial infarction or ischemia of the heart disease is represented by the ST segment. another interpretation of the ECG. What does it mean? After the description of the ECG, if you have found any abnormality under the topic of the interpretation, you should think more about this underlying pathology condition. If the ECG is normal, you should give normal report. If you have got any abnormal finding, we should focus on that finding to find the underlying cause of pathology condition. And after that, you should immediately draw 12 standard ECG reads. If you draw this 12 standard ECG read, then it means that you have got information about the ECG, or you can know more or less about the ECG. This is a 12 standard ECG lead. Lead 1, standard lead 2. Lead 2 is the largest lead of the ECG. And lead 3, this is lead 3. And AVR is a negative lead in the ECG. And AVL is the smallest lead in the ECG. And in the QRS complex, in the chest lead, we have got V1 and V2 represent right ventricle. It look at the right ventricle, but provide information about the septum. This R that you see, this is the septal R. This is a small r. And V3 and V4 should Q and R and S, both of them are equal because it represents transitional zone. And finally, we'll go to the V5 and V6. The V4 is larger than the V6. And the V6 because V6 we put in the anterior auxiliary line. And after, because our have got soft tissue, then the lines, this electrical impulse should move from the lines, tissue, skin, and finally reach to the V6. This is why the V6 is smaller than the V5. This was in today's lecture about